Hi, I'm Kate with Rock Valley Health, and today we're going to talk about your LDL cholesterol. Well, LDL sometimes gets the bad reputation of being the bad cholesterol or lousy cholesterol, but we do need some of it in our body. The LDL helps transport that total cholesterol through the body to where it needs to go to do the job it needs to do. But too much of it can stick in our arteries and lead us to higher risk for heart attacks and stroke. Because of its association with higher risk of heart attack and stroke, the Heart Association has a few categories that they base your LDL recommendations on. It can be slightly confusing, so let's see if we can make it a little bit easier to understand. So if you're at intermediate risk for heart disease, which many of us are, maybe we have some family history, we like to see less than 130 for your LDL cholesterol. If you're at a little bit higher risk for heart disease or stroke, so maybe you have diabetes, high blood pressure, or maybe have a higher total cholesterol, less than 100 is going to be the target that you're looking for your LDL. Now, if you're someone who already has heart disease or has already had a heart attack or a stroke, or maybe at a very high risk because of some other medical factors, less than 70 is what we're going to shoot for. So the key is the lower the better for your LDL cholesterol. So what can you do to get that number lower? Well, many things involve your dietary choices. So eating a balanced diet with a variety of type foods is really going to be helpful. Focusing on the fiber and whole grains in your diet can really go a long way. So eating things like berries that have a higher amount of fiber are great. Looking for things that are nuts and beans, legumes, avocados, whole grains in your breads and your pastas. So when you're choosing a pasta, look to see what it says on, what is it called? And then look at the ingredients list. Same with your breads. Is whole grains one of the very first ingredients? Then you know you're making a better choice. These foods are very high in fiber and can be very delicious, so it's easy to incorporate them into your diet. Now, some foods that we should be mindful of and maybe avoid are the trans fats and the saturated fats in our diets. These foods can increase your LDL cholesterol. So choosing foods in their natural state rather than being processed and prepackaged will just automatically help you avoid some of those trans and saturated fats. Trans fats are often found in fried foods and in cookies, crackers, and snack type foods. Saturated fat is a fat that is found in a lot of animal products. So the way you can find it is it's found a lot in red meats, and red meats do include beef, pork, and lamb. It's also found in a lot of dairy products that are solid at room temperature, so like butter and cheeses. So these foods can be part of your normal diet. What you want to make sure is to think of how often are you eating these foods and what quantity are you eating these foods of. So variety is really a key. And this variety in your diet and making some healthier choices will also help keep your weight in check. And when we carry excess weight, especially excess body fat, it's hard for our body to get rid of that extra LDL cholesterol that we don't need. So making some good choices nutritionally and staying active to keep your weight at a normal level will also help improve your LDL cholesterol. And there's one other factor that you may not even think about when it comes to LDL and total cholesterol. It's your stress level. When we carry a lot of chronic stress, our cortisol levels are higher, and that makes it harder for our body to get rid of the extra LDL cholesterol. So, learning and then using some ways to help manage your chronic stress, such as journaling, talking with a friend, going for a walk, taking a few deep breaths, can go a long way to help actually control our LDL cholesterol levels. I hope you found some of these tips helpful, and thank you.